Good afternoon and welcome to the Leadership Checkup series hosted by the National Council for Behavioral Health and the Association of State and Territorial Health Officials. My name is Casey Wu and I will be moderating today's webinar. Thank you so much for joining us. Before we get started, I'd like to quickly run through a few housekeeping notes. To access audio for today's presentation, you can listen through your computer speakers by clicking Join with Computer Audio, or you can join by phone by selecting that option and dialing the number that's shown on your screen. Upon entering, you will be automatically muted. Please keep yourself muted for the duration of the webinar. We'll have time for Q&A at the end, so feel free to send your questions to the presenters using the Q&A feature at the bottom of your screen. You can also respond to any questions that the presenters ask in the chat box. And finally, today's webinar is being recorded and will be archived for future viewing on the National Council and ASTHO's website. I'd like to take a quick moment to see what types of organizations are represented on today's webinar. So I'm going to pull up this poll, which should launch on your screen, and just give everyone a few moments to respond. Okay, and I'm going to close the poll in 5, 4, 3, 2, 1. Okay. So it looks like we have a pretty wide range, a lot of local and state health agencies and community behavioral health, some education facilities as well. So that's really exciting to see. So thank you all for responding to that. Just a quick introduction. The Leadership Checkup series is a collaboration between ASTHO and the National Council's Behavioral Health Training Institute for Public Health Officials, designed to support state, local, tribal, and territorial health officials through this unprecedented public health crisis. The goals of the Behavioral Health Training Institute are to increase the knowledge, skills, and abilities of public health practitioners and workforce to improve and enhance behavioral health strategies within public health settings. Today's presentation, Avoiding COVID-19 Burnout, Self-Care, and Resiliency for Public Health Leaders, is presented by Joan King, Integrated Health Senior Consultant, and Lisa Guroff, Director of Trauma-Informed Services at the National Council for Behavioral Health. Joan is a clinical nurse specialist in adult mental health nursing with over 30 years of experience in the behavioral health field. She consults with counties, states, and primary care and behavioral health organizations to develop integrated systems of care that promote wellness. She's also provided consultations on developing recovery-oriented systems of care at state, local, and agency levels, and is dedicated to lifting the voices and stories of people in recovery. Lisa has over 25 years of experience in the behavioral health field, providing direct clinical services, clinical supervision, and administrative direction. She has worked in a range of clinical settings, from treatment foster care to outpatient mental health to a variety of residential settings for children and adults. Prior to joining the National Council, Lisa was the COO of a large mental health provider where she oversaw and directed the implementation of trauma-informed care practices across the agency. At this point, I'd like to turn it over to Ava Mason, Senior Director of Leadership and Learning at ASTHO, to provide some opening remarks. Ava.
Thank you so much, Casey. It is my great honor to welcome all of you to today's session. As our nation continues to struggle with COVID-19, public health professionals at the state, local, federal level all remain on the front lines day to day. And you're balancing the work that you love and that you do so well with increasing scrutiny from the public, personal safety concerns, as well as the emotions and anxiety of caring for your loved ones and your friends. So to say that there's a lot going on is truly an understatement. But those of you who serve in these positions are our genuine heroes. And I would like to acknowledge all that you are doing daily and just want to say thank you. ASTHO is so pleased to work with the National Council for Behavioral Health to provide this leadership checkup series as an opportunity for you to better understand the impact of all that you are experiencing. And also to take time to provide just a few minutes to pause for some reflection, nourishment for yourself, and self-care that will help you set up routines that will build and sustain your resilience moving forward. While we do not know how long we will be in the throes of the pandemic, we really want to be able to provide some strategies and tips just to help you be able to work through this time so that you can be the best possible you at the other side of COVID. So I believe we have a record number of registrants for the session today, which tells us just how important this topic is. And I'm very excited to hear from our two experts. They have a wealth of experience in trauma-informed services and resilience. And Joan King and Lisa Guroff are wonderful presenters. So I hope you're in for a treat. Today, the information will be both practical and informative. And so we hope that it is immediately useful for you. Again, we welcome you. And I would like to turn it over to Lisa to get us started.
Thank you, Ava. Definitely very excited to be with you guys again and to share with you, my colleague, Joan King. We are in the middle. We're in our third webinar in this series. We've been talking about moral injury. We've been talking about how as leaders, we can support our staff. And today we brought Joan in to talk about you and how you can take care of you and why that's so important. As Ava said, we want to make sure that you have your best self at the end of this long, complex, traumatic experience that we are going through. So I hope you enjoy, and I know you'll enjoy Joan. I enjoy working with her every day. And so, Joan, thank you for joining us and bringing yourself today, and I will turn it over to you.
Thank you, Lisa and Ava, and thank you all of you who have joined us. I have a particular place in my heart for public health officials. I do a lot of work in Montana and have worked pretty extensively with some of the health departments in Montana, and I am acutely aware of both how important your roles are, also with the tribal authorities in Montana, and also how stretched you have been during this time. So really want to just thank you for the work you do. And as Lisa said, we really do want this next 50 minutes or so to be a time for you. So I'm going to ask you to join me in a moment of meditation and kind of centering, gathering your thoughts to this present moment. I don't know about all of you, but one of the things I have learned over the last 7 months is how everything, all the noise, all of the chaos, all of the trauma we've been through sometimes makes it hard to be present in this moment. So I'm going to invite you to use this picture, which is a picture I actually took myself at Flathead Lake in Montana. I'm going to ask you to just get your feet situated on the floor. Sit as straight in your chair as you can to let energy flow up and down your spine and around your brain. And begin to focus in on your breath. That amazing gift we all have that brings oxygen to us, takes waste products out, but also is a tool for grounding. And as you focus on your breath, notice if there's a catch as you take those breaths in and try to deepen the breath. This time in our lives has come with grief for many of us in different forms, And I just ask that you notice and honor whatever that is for you today, or maybe today you feel great, and that's wonderful. Unacknowledged grief stands in the way of peace and also grounding and joy. So acknowledge it, honor it as you continue to deepen your breath. And then as you hold that, or maybe are able to release it, I would ask that you think about what you're grateful for today, in this moment, right now. What small thing, a solid office chair, the view out a window, a good cup of tea, whatever that thing, that moment of gratitude can be, say thank you. And last, I'm going to invite you into a space of grace. You all carry many, many varied responsibilities, both in your personal life and in your professional life. Sometimes it can feel like there's so much, it's hard to feel like you're doing anything well. Sometimes those of us who care deeply judge deeply. And I would invite you to just let go of judgment in this space. Know that you right now are enough, and what you're contributing is enough. And as you take 2 or 3 more deep breaths in your own time, I would just invite you to hold this time dear for you as a way of committing to your own wellness and to your own health as we talk together about possibilities and strategies. And when you're ready, open your eyes and join me again. Oh, thank you for joining me in that. And if we can go to the next slide, we'll just take one more moment to think about bringing ourselves here using Brene Brown's permission slip. And I know sometimes, particularly now that we live in the land of Zoom and technology, it's easy to think, okay, I'll listen to this webinar and I'll do this and I'll do this and I'll do this while I'm on the call. I would invite you to just think about what you need to give yourself permission to do or feel or not do for the next 45 minutes so that you can really show up here. And if you have a paper near you, I'd invite you to write it down, because when we write ourselves a permission slip, we're more likely to take it seriously. And so I would invite you to do that. And we'll just pause here for just a brief moment so you can give yourself that permission. Okay, so what our objectives are for today, if you go to the next slide, Casey, we're going to talk about anxiety, which has become a companion for many people in this country and probably around the world. I haven't looked at the worldwide data, but I know about 30 to 40% of people in this country are reporting increased symptoms of depression and or anxiety. And so I want to talk a little bit about anxiety, what it is, how it impacts us, and then really dial in on what are possible coping mechanisms that we can use to help to manage anxiety so that our energy doesn't get dissipated there, but we can use it to focus on the work at hand, both in our personal and our professional lives. And then we're going to talk about some daily routines, daily habits to manage anxiety. We'll be sharing some, I'll be sharing some with you, and then we'll also, be gathering more from you in the chat box. So I want to start with a video which we've tested, and I think you'll be able to hear it. I hope so. I always feel, Stephen, even all these months in, feel a little anxious about this. But this video is really, it's about 5 minutes long, and it will take you through a little bit of theory about what anxiety is and a little bit of practical thoughts about how to manage it, and then we'll follow up on that with some additional thoughts. And you will notice that there probably will be a lag time between what you're seeing in the video in terms of the movement and the words. So if that really bothers you, just look down, don't look at the video, just listen to the content.
So anxiety is rooted in biology. It's evolutionarily based in that we have our own fight or flight responses. Some of it is very old and triggered from the deep part of our brain, that is the oldest part, the fight or flight response. And then some of it comes from the cortex, which evolved much later, and that's worry. And that might be 21st century anxiety, because there's a lot we can find to worry about these days. Are we going to make enough money? Are we going to get the right job? Are we going to provide for our families? Are we going to do the right thing? What could go wrong in the world? So many things can trigger anxiety just by walking through everyday life. But the good news is our systems are also set up to handle it. The beauty of anxiety and the system that we have of anxiety that's all throughout our nervous system is that it evolved to protect us. So there's two components to it. The oldest being the amygdala, which is deep in the brain, in the reptilian part of our brain, signals whether we should fight something, flee something, or freeze. When it goes awry is when it's perceiving immediate danger that really isn't there. Somebody's heart starts to race, and they think, oh my goodness, is something wrong with me? That's panic. And that can send somebody into a panic attack, which is the clinical manifestation of the fight or flight response. The other thing with anxiety is, again, as we evolved and became thinking human beings and started building communities and cities and civilizations, is our brain evolved, and there's the cortex. It's within the cortex that we think. It's within that system that we worry. And so we can worry ourselves into states of anxiety where we are fraught and not knowing what to do, and we actually get stuck with anxiety, and so we're tense and irritable and upset. So what makes the difference between everyday anxiety, which we all experience? Anxiety is perfectly normal. In any form, it's perfectly normal. Having your heart racing because somebody is walking behind you and you don't know who it is kind of normal. But if you let that happen to you when you're sitting alone at home and you start having panic, then that gets out of control. And worry about what to do in the future is normal for all of us, but if we can't move our minds off of that and onto what do I need to take care of here, and let me enjoy my family while we're doing this thing and activity, and I'll problem solve that later, then that becomes a problem, and that might become an anxiety issue. What was great from the 1990s all the way through to now is it sort of was the age of anxiety in terms of mental health treatment development. The 1990s opened up lots of treatment funded here in the United States by the National Institutes of Mental Health, and then also in other countries did similar things, where cognitive behavioral therapy became the most tested and developed treatment and found to be the most effective psychological or talk therapy for managing anxiety. And managing anxiety of all kinds: obsessive compulsive disorder, panic disorder, generalized anxiety disorder, and so forth. Social phobia, the #1 anxiety disorder in kids and adults. Cognitive behavioral therapy is great for that. So we put a lot of work into developing these treatments and perfecting them. And then also there are great medications actually that were developed through that time. The combination of the two treatments works best for many people who are debilitated by anxiety. But these treatments are excellent, and they are available, but not widespread. So this is where, again, technology comes in, because technology has allowed us to put some of the skills training and some of the aspects of cognitive behavior therapy into apps, into online programs and such, that then can reach hard to reach individuals and people who don't have access to services. There's some very exciting work being done today throughout the country and around the world in terms of anxiety research, looking at, in different ways, what aspects of the brain are working with the amygdala and the cortex in terms of turning anxiety on when it doesn't need to, keeping it going. What are the triggers for anxiety on all different levels, from genetic all the way through to what's in the environment, and then helping to sharpen our treatments to direct themselves to those mechanisms and tamp down those mechanisms, so that can help a person probably earlier in the cycle of anxiety, earlier in life and such, and to manage. So neuroscience is coming on with all sorts of ways of looking at what are some new technologies, including different types of computer apps and stuff that target anxiety processes. And then there are also ways of disseminating treatments and reaching people that we are working with. So I think the big exciting part of what we're seeing over the next 10 to 20 years is going to be much more dissemination of more targeted and I think more effective treatments for people that are going to be coming on board and going to be disseminated through many different means, not just through your local therapist like me, but also through many different types of technologies that are going to be made available.
So several of you are asking, we have at the end a whole series of resources, and some of them, so that video, the link to that video is at the end. And in addition, some of those resources that she talked about that are really practical tools that people can use, that sort of take what we know from cognitive behavioral therapy and apply it in your day-to-day life. Some of those resources are there at the end. So when we get there, you'll be able to get a hold of them. And I think, you know, the takeaway for me is severalfold. One is that, as this slide says, anxiety is a normal response to a stressful situation. It's biologically based. You want to have that kind of physiological response when there is present danger. The challenge for many of us, particularly in this time of COVID, is this is a stressful situation like we haven't encountered before. I think it's been, and for many people, as I talk to people across the country, one of the things that's been anxiety producing is the things that have historically mitigated anxiety, like close relationships, like family connections, friend connections. Those things have been more limited and have been part of shifting those things, has been part of the stress of the situation. So if you're feeling anxious, that is a normal response. We want you to take that away. And what we also want to talk about is kind of what can help with that. So if we can go to the next slide, I also want to just talk a little bit about some of the common reactions I'm hearing to COVID. And I want to underscore, we're getting some great questions in the question box, and I am going to come back to those questions because they're really, really important. I'm just going to pause and give a little bit more content before we come back to them. So there are as many reactions to COVID as there are people in this country. You know, there are people who are saying this isn't real. Okay, that's probably not most of you on this call because of the kind of work you're doing. But you know, the concern about how do we protect ourselves, particularly if you and or a family member are in a high risk group, that's been a real challenge for folks. Is you know, and for many of us who've never considered ourselves at risk before, all of a sudden because of age or because of a medical condition, we have to kind of change our perception of ourselves. Not being sure that the services we need are going to be available to us, whether that's regular medical care, dental care, feeling isolated, and particularly those of you who live alone or who are living in retirement communities where you haven't been able to have visitors, but also those of you who, have close friends, families you haven't been able to connect with, people who have needed help with daily activities, but then you're worried that the helper is being exposed. Those are common reactions. And then we're seeing increased levels of distress among people who have already had existing mental health concerns, or, there's a huge equity issue here in responses to COVID. So if you already were living on the edge in terms of finances and now your finances have been impacted, obviously that's a really high level of concern. You may have language barriers, or you already were experiencing stigma because of a variety of reasons, or you are in a group that is now perceived as, spreading COVID, whether that's when that's not based in reality, but all of those things can cause increased anxiety, as well as living in the uncertainty. And I think for all of us, again, as I talk to people, both private clients and in my work across the country, the not knowing kind of what's the trajectory, what's the end, all of those things can add to the anxiety that many people are experiencing. Next slide. And we know that outbreaks are stressful. And we've talked about some of these things. So the fear of your own health, the health of your loved ones. I know early on, my son-in-law's parents both got COVID, and that was a really scary time. That was in the time we didn't know much, and they were really, really sick. So, all of that. People are also experiencing changes in sleep, and that was one of the questions which I'll come back to, or eating patterns. I mentioned already the difficulty concentrating. There's been a real concern in the physical health care arena around what has happened to people, particularly during the time when we were, when most healthcare was not seeing people face to face. Lots of people who had chronic health problems experienced exacerbations of those problems, and we talked about mental health. We've seen an increase in the use of alcohol particularly, but also tobacco and other drugs throughout this time. Next slide. So, I think, as we think about then starting to step into, so what do we do about all of this? Lisa and I remember the day I forget which one of us found this on Twitter, but I remember it was quickly circulated among the consulting team and other staff at the National Council, because, for those of us on the consulting team, in a sense, we always worked remotely. So what's the big deal? And we were all sort of talking to each other about, why are we so stressed? And then this came out, and I was like, yes, exactly. That we're not just working from home anymore. We're at home during a crisis trying to work. And again, this comes back a little bit to the cognitive therapy. Those distinctions in how we think about the current experience are really, really important. The fact that we are at home during a time we've never experienced before, still trying to work, and for many of you also trying to manage children who are out of school, other family members who are now working at home. Next slide. So if we acknowledge that and we recognize this is a stressful time, that it comes with some fear, more or less at different points in time. What are some strategies? And that's really what we want to talk about for the rest of this call. What are some strategies? And so, first of all, finding that balance, and it's a different balance for different people, between staying informed but not being connected 24/7, because the 24/7 news cycle, just the noise of it activates that anxiety system. And so really figuring out for you, What's the balance? How do I find the balance? How much is too much? How much time in social media is too much? And then focusing on what I can control, okay? So what can I control? I can control having a self-care plan. I can control how I develop strategies to bring myself back when I start to spiral. I can control how I connect with other people, even when I'm physically isolated. So how do you identify your support system? And I think this is really important. When you're looking for support, what you want is not someone who's going to amp you up, but someone who's going to help you sort of settle in, or that the two of you can help each other, or three of you can settle in. And we're going to talk about how you take care of your mind. This says body and spirit, but I would say your mind, your body, and your spirit. And some really concrete things. I want to pull out a couple things here because they aren't coming up later. Nature, getting out in nature. Even if it's walking out your front door and looking at whatever is outside, I cannot underscore how important that is. It calms the brain. And then really thinking about what are some other strategies, which, as I said, we'll talk more about the concrete ones. Can we go to the next slide? So when we think about dealing with stress and anxiety, this is really, so how do we take care of our mind? First of all, and this is hard for, I suspect, many of you on this call who are high achievers, accepting what we can't control, and that there are some things that we can't control. Lots of things we can't control. And so I actually identifying, do I have control over this thing? And if not, then I have to let it go. I have to find a way to let it go. Doing your best. And that comes back to what I talked about in our focusing time. Giving yourself grace and acknowledging that you are enough. Positive attitude, and what I would say about positive attitude is I agree with that, and it's not always possible. So part of grace is to say, you know what? In this moment, I am in a bad mood, and I'm not going to inflict it on the people I love, and I'm going to do what I need to do, go for a walk, do some yoga, do some deep breathing to get past it, but we want to really allow ourselves that moment and then try to maintain that positive attitude and really pay attention to triggers. So what is it that triggers your particular anxiety? And then as much as possible, avoid those things or shift those things. Next slide. And mindfulness is an incredibly powerful tool for managing anxiety and for taking care of your mind. And mindfulness works at that body-mind-spirit intersection. So it impacts your body, it impacts your mind and your spirit. So I'm just going to, again, short little video that I think will really sort of lay that out for us. So Casey, if you can start this. And again, the little cartoon characters won't be, they won't be talking in sync.
There's a story, usually attributed to the Native American tradition, which illuminates different ways of paying attention. An elder, talking to a child, says, "I have two wolves fighting in my heart. One wolf is fearful, vengeful, envious, resentful, and deceitful. The other wolf is compassionate, loving, generous, truthful, and peaceful." The child asks, "Which wolf will win the fight?" The elder responds, "The one I feed." That doesn't mean we try to deny or hurt or kill the angry wolf. If we did that, we'd end up in a long battle, all the while somehow making that wolf more powerful through our hostility and fear. Hating that wolf sucks the strength right out of us. Instead, we calmly pay attention to the angry wolf and let go of believing they have the answers. If we can do that, they end up lying down next to us, no longer an enemy. We help strengthen the kind and loving wolf, giving it nourishment and support so that we can follow it. That peaceful wolf can become our steady companion and show us the way through all kinds of different life experiences. Restful or chaotic, enjoyable or disappointing experiences may come and go, but we can have a guide with us through it all. This is what mindfulness can help you do. Mindfulness allows us to see our thoughts and feelings as they are beginning. It's very powerful to know what we're feeling as we're feeling it, know what we're thinking as we're thinking it. With mindfulness, we can choose what will strengthen and bring into action, and we can choose what we will gently let go of. We don't have to be at the mercy of old habits or old ways of thinking or old ways of being. We are empowered. It just takes practice.
And I love that. We can go to the next slide, Casey. I love that last sentence. We are empowered. It just takes practice, because it does take practice. And the more often you return to something as simple as putting your feet on the floor, sitting up straight in your chair, and taking 3 deep breaths, every time you return to that, your body begins to understand that and to know that and to learn it. And then taking it from there to even more extensive mindfulness strategies. When we think about, and again, it's this idea of body, mind, spirit. Anxiety affects body, mind, spirit. There's been, as I mentioned earlier, there's been an uptake in use of alcohol. And I think, when you're working at home and the coffee pot is right there, there can be a tendency to go with caffeine. Both alcohol and caffeine can aggravate anxiety. And so really paying attention to kind of what you're using, what you're doing when you're anxious, and are you heading for the coffee pot or for that, second glass of wine in the evening, instead of heading toward some of the other strategies that we've been talking about and we'll talk about. Eating well-balanced meals. I think one of the takeaways from COVID is going to be that many people in this country have rediscovered their kitchen. And so really kind of making sure that you've got this balance in your diet, that it's not all, tasty cakes and cookies. And then sleep, really, and that's what one of the questions is about, so I'm going to come back to that. And I know sleep has been a real challenge for many people, but as we're stressed, when you're tired, when you find yourself tired at the end of the day, give yourself permission to get to bed on time and rest. And then exercise. Exercising, I can't stress enough how important that is, especially during this time. These are things we always know, and it's like, yes, I've heard this. And as I say to people in a training I give called Case Management to Care Management, if everybody did what they knew was helpful, none of us would ever probably need healthcare. We would all just be healthy. But so it's hard. So there's a choice point here. But I'm underscoring what you know already, and then we're going to talk about some other really simple things to think about, how to put these things into practice. So can we go to the next slide? So we've identified here some simple ways to really begin to relieve stress and anxiety. And what I would say about this whole area of body, mind, spirit, self-care is what works on one day may not work on another day. And so it's really about thinking about having, kind of a wellness toolbox. So what are the things on this list here that have been helpful to you in the past, or that you might think about bringing into your day-to-day life? And what I'd like to ask is if just in the chat box, some of you could really just type in things that you don't see on this list that you find really helpful. Because some of the things on this list, I think, listening to music really can help to dissipate that anxiety and can take you there. And yeah, somebody piped up and said weeding the garden. Again, really something we don't all think about. May not work for everybody, may not work for you at certain times, but really helpful strategy. Crafts, spending time outside, going to the beach if you can, lighting a candle using essential oils, picking fruit, playing board games. You're putting in thousands of things here, so pay attention to what's coming in the chat box, because for those of you who are struggling with strategies, you're getting some other strategies. Playing with children, playing with pets, reading, adult coloring books, blowing bubbles, absolutely a mindfulness activity. So thanks for all the ideas you're putting on here, and I hope all of you are able to kind of take advantage as they fly by. When you have over 1,000 people on a call, you're going to get some great strategies.
Joan,
yeah.
Joan, this is Lisa. Hey, we have a question in the Q&A that if someone is struggling with chronic fatigue, and you mentioned that we should try and avoid caffeine, but for them, they really need to use that to manage their chronic fatigue during the day. What other things might someone be able to kind of counterbalance that? Or are there other things, if you're not able to, completely from the caffeine, that you would suggest?
Yeah, so I think part of what, so I drink coffee. I love coffee. It's like my favorite thing. It's one of the few things that this household has overbought because we want to make sure we have it if the supply chain gets disrupted. So true confession. Everybody has a different tolerance for coffee in terms of when it trips over into anxiety. So let me just give you a really concrete example. One of the things I've learned in the last 6 months is I can't have a second cup of caffeinated coffee. Pre-COVID, no problem. I used to often would have a cup in the morning, a cup mid-morning, and then sometimes even a cup in the early afternoon. Now, if I have that second cup of coffee, I get palpitations and I can feel my anxiety level going up. And I think that's because, my level is a little higher than it was pre-COVID. So for those of you, particularly, for those of you who have like chronic fatigue syndrome, who really may need that little extra edge, I would just pay attention to where is your edge, like how much is okay, and then how much amps you up to a point where you're more anxious, and you may find yourself responding more with irritability and an increased anxiety level. The other thing I would say is, sometimes we go to caffeine instead of doing some of the things that are on this list or some of the things that have come in the chat box. And so is there another thing that might be able to help you? Would a glass of water have the same impact? Maybe, maybe not. For some people, that makes a big difference. I know that for me, I get more fatigued, especially now that I'm sitting in front of the computer when I'm not drinking enough water. So I hope that's helpful. Lisa, I don't know, do you have any other ideas about that?
No, I thought that was great. And yeah, very, very helpful. And I would agree with you. People can, the chat box here, things are whizzing by. I did want to, a couple people have mentioned SMASH therapy. Joan, we have someone on who actually goes out and buys used crock pots and finds it very cathartic to smash the pottery crock pot on it. And actually, we're getting a lot of comments about that being a very helpful stress reliever, apparently.
Yeah, and I've heard recently in my case to care training, I've heard about axe throwing, which I'm not super coordinated. That makes me anxious, but for some people, that's apparently really therapeutic. So
someone, Heather, just put that into our chat as well. I was a therapist in a very rural community, and we actually had a family that would go to tag sales or flea markets or yard sales, whatever people call them, and buy old plates and go out into a forest area of their yard, of their property, and throw those. So I think what we have to recognize is, like you're talking about, we are in such this unprecedented time, and our bodies are constantly bathed in adrenaline and cortisol, and finding ways. Different things are going to work for different people, but finding ways to release that stress from your body is going to be really important. Take a vacation, check out, even if it's a staycation, you know, reevaluate maybe even your sleeping, you know, at night, or your, you know, your patterns before you go to sleep. You know, I found that I need to go to bed a little earlier than I used to.
Yes,
Like I just
absolutely.
can't bounce back, you know, up in the morning. Not that I ever really bounced well in the morning, but definitely, you know, it's okay. It's okay to take those breaks, and so important. So why don't we keep on moving? I know you've got a lot more for us.
No, Lisa, I just want to follow up, because there's a comment in the chat box that you just led beautifully into that I want to make sure that we follow up on. So the comment is basically that you know, the pressure to to do self-care can become another thing that you feel like you're failing at. And so I just want to underscore 35 times, if I can, this thought. One of the real struggles for me, again, disclosure, one of the real struggles for me in the beginning of COVID was I would see, and I would see on Facebook, and I would hear from people who were saying, I'm learning a new language, and I'm learning to bake bread, and I'm making sourdough, and I'm remodeling my house. And like, I was holding on by my fingernails. I mean, like every day was like, can I make it until the evening? Can I make it until the evening? And so, you know, one of the things, I'm not feeling that way anymore. I'm feeling really different, and I'm in a really different space, but I'm very aware that some people are feeling that way now. So what I tried to do through the grief, gratitude, grace meditation there at the beginning is give you a space to be where you are. And so please don't hear anything here as shoulds, oughts. There's one right way to do this. There's not one right way to do this. We all have to find our own ways. And my commitment when Lisa asked me to do this was just to try to provide some ideas and some support as you think this through. We're all, you know, I come back to this saying over and over and over again, we're all in the same storm, but boy, are we in different boats. And so I just want to acknowledge that and say, you know what, if all you can do to take care of yourself on a particular day is take one deep breath, that's great. Or crash in front of Netflix in the evening, if that's what it does for you, all the more power to you. And at the same time, we have to acknowledge, as Lisa said, that our bodies are all bathed more in adrenaline than they ever have been. So Lisa, I hope this is okay with you. I'm going to just deviate a bit from the slide deck because there's a couple other questions that I think would be really helpful to get
Absolutely,
to.
Joan.
Is that okay?
Absolutely. Let's do it.
All right, because I don't want to like not give you content, but there's a couple really good questions here. So someone says, how do we avoid procrastination when dealing with stress and anxiety? Boy, is that like the $1 million question. And I think, so here's my recommendation for that. One of the things that happens when we're stressed, when we're overwhelmed with anxiety, is we lose focus. And then as we lose focus and we feel further and further and further behind, it becomes sort of this cyclical, vicious circle of, I have so much to do, I can't focus, I can't do anything. And so the mantra I say to myself when I'm in that situation, and this may be too simple, is do the next right thing, okay? Which I know comes out of 12-step. It just has been incredibly helpful to me. So I can look at this pile of to do on my desk, you know, either on the list or in my email or whatever. And when I start to get overwhelmed with stress and anxiety, what I say to myself is, you can't do it all, do the next thing, do the next thing, answer one email. And I try to get myself moving in that way. So I don't know if that's helpful to you. That's sort of my strategy. The other thing is, and again, in the first couple months, I really had a struggle with this. I have to run with a to-do list, and then I pull off the to-do list one or two things that I'm going to work on that particular day. But it is a challenge. And the other thing I would say is, when you start to feel yourself getting stressed and overwhelmed, that's a time to take 3 to 5 minutes. So somebody said, how do you check out when there's no one to take over for you? I used to work in my earliest nursing experience. I worked in a surgical intensive care unit for 5 years, and where we had either major trauma or open heart surgery patients coming back from open heart surgery. And there would be times when I would literally go into the bathroom and I would close the door for 3 minutes and I would just breathe. And if that's all you can get, that's enough to help yourself get re-regulated. When you feel like there's nobody else in your community to take over for you, that's probably true. I mean, that is the reality for many of you, at least as I've watched, you know, in some of your roles. However, all the more reason why, if you're sick, there is no one, okay? And chronic stress, chronic toxic stress, unmanaged, will put you under. So all the more reason why I say to everybody, it's no longer optional for me. I have to do certain things every day or I really can't keep functioning. And then I really want to get to this, this one, which is a very, very tough question. And we've got a slide later about responding to the responders, but I'm going to pick this up here. What are some suggestions for responses for colleagues who articulate that they're losing sleep about the people who are dying on their watch? And this is a really tough question. And, you know, one of the things I have had high levels of concern about are those responders who are in this. So what I want to suggest, Casey, can you jump to the responder slide? I just want to focus there for a minute. Yeah, thank you. You know, the risk there is this secondary traumatic stress, which I think we all know that people who are first responders, people who are working in hospitals are experiencing. And so again, I think the idea of grace comes in, which is really what this first block is about, which is everything speeded up, but the reality is it's going to take time for you and for your family to recover from this experience. And because you're still in it, it's going to take times, if you can put it that way. I think, you know, creating a self-care plan, and somebody here had a great example of that. I'm trying to get back to it in the question box, who she said, I work third shift, so I'm used to be able to self-care once I woke up at 3 p.m. by going out and about, and now I'm not able to do that. So I'm still trying to find ways to get out and feel the sun on my face. And I went back to that. I know you're asking for, the person who wrote that is asking for ideas, but something as simple as feeling the sun on your face can be regrounding. If you're being troubled at night by visuals and memories, etc., a couple things. Number one, you may very well need to get yourself connected to a therapist, because and those of you who've worked in this environment, you know what I'm talking about. I mean, if you talk to people who've worked in these environments, ERs, intensive care units, hospitals, you know, EMT, they'll tell you years later they've got visuals, okay? But what we want to do is unlock the feeling from the image, okay? And so you may need to get some help with, you know, EMDR, some other kinds of therapy to help you make that disconnection, because it's really serious and it's really hard. You know, and then again, I think media distancing, doing whatever you can to have those 3 to 5 minutes of self-care as you move through your days. Okay, and then how do you recharge when you can't get a vacation or a day off due to the high tempo? Here's where I would say look for a mini vacation. I'm trying to be really pragmatic here. First of all, you know, I think we have to, and this is one of the things that or some organizations have done a great job at and others really struggled at. Leadership, and I know you're going to talk about leadership, Lisa, so you can take this in the next week, but I think leadership has to say you have to slow the tempo down. I mean, the reality is the work will be there when you get back. So that's easy for me to say, I know, but hard to implement. What I would add to that is look for those little mini breaks. On a Friday afternoon, can you leave at 3 and go to a local park and socially distant, just be outside? Can you come in later on a Monday morning? Look for those little mini breaks, or can you make sure that at least in the middle of the day you have a lunch that isn't sitting in front of your computer, shoving in your lunch while you're working? And then there was another comment. Yeah, go ahead, Lisa.
Oh, I was just going to say, it really reminds me of, and I believe we've mentioned this in previous webinars, but the work of Dr. Bruce Perry.
Mm-hmm.
A lot of our interventions, as even mentioned in the video, are all about those top-down things. Once we're calm, then cognitive behavioral therapy works because we're able to access higher levels of thinking in our brain. When your body, my body, a human body, is bathed in stress hormones, and we are in that fight, flight, or freeze all day long, we can't access those higher things. So sometimes it's writing down what your coping mechanisms can be, so you can just even look at the list and be like, oh yeah, I could read a book, But sometimes it is really falling on that work of Dr. Perry of finding ways to just center and ground yourself, because until your body is relaxed, until your mind is clear, you're going to be in that space. And so, we talked in other ones. I would encourage you to look at his work and his 6 R's of really finding rhythmic, repetitive, relevant relational things to calm your body and decrease those stress hormones.
Thanks, Lisa. And I am very aware that there are many, many questions in the question box that we're not going to get to, and that we're almost at the top of the hour. So, and Lisa, I know you want to wrap us up, but let me just say a couple things. First of all, I want to just thank the person who put in to acknowledge our friends and colleagues in the West who are now experiencing also the stress of fires, and just to say we're with you. 2020, what can we say about 2020? Second of all, I just want to underscore, because there are comments in the question box about, people who are having trouble getting out of bed, people who really have anxiety that they're having a very difficult time managing, people who can't sleep at all. Please, please, please know that there is help around you, and it is not a sign of weakness to reach out for help, especially right now. Always, but we just don't have the teeth. We're all cutting our teeth right now in this time. So please, 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 please take care of your one precious life. I hope this has been helpful, Lisa. I know there's a couple things you want to say in wrapping up, so I'm going to turn it back over to you because we've only got 1 minute left. But thank you for all of the comments, and yeah, be well, be well.
Thank you, Joan, so much. I am really seeing a lot of pain, a lot of exhaustion in the chat box, as well as so many creative, out-of-the-box ways in which people are dealing with their anxiety. And, we will attach a journal entry as well that you guys can use to, just make sure you're honoring all that you're learning about yourself during this time. We definitely want you to come out of this in a resilient or post-traumatic growth perspective. We do not want the current crises to burn you out. As I've said in our other webinars, you have one body and one mind, and the one that you have now is the one you're going to have afterwards. So please take care of it. Please make sure that you recognize the importance of taking care of you first. We're all going through some really difficult time, and I see the pain, but I also see that creativity and the resilience. So thank you guys so much for joining us. We will get you the slides and the recording, and the last slide in the deck does have a lot of the links as well. And if there's anything new, there were some questions about culture and things in organizations. We can absolutely at the National Council support us or support you guys in your work, with your organizations and cultures and things like that. So please reach out. We look forward to hearing from you guys, and I look forward to being with you in 2 weeks.
Thanks, everyone. And just a quick reminder that the slides and recording will be archived on the National Council and ASTHO's website. We'll be sending out a follow-up email tomorrow that will have the link to the archive, and the recording will be available within 48 hours. I've also put in the link to register for our next webinar on September 24th, so I hope you all can join us. Thanks so much.